Hello, everyone. Welcome to the 13th episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, Alex Koshykov, who is the COO of BeKey and author of the U.S. Healthcare Newsletter, where he analyzes U.S. healthcare from a Ukrainian refugee perspective. Thank you for your time today, Alex.
Thank you, Dylan. Thanks for having me, and I'm super excited for your show.
Yeah, awesome. And what made you become interested in just the field of healthcare overall?
Oh wow, that might take some time to tell you the story. So uh, I guess I got into healthcare by accident. I was studying public relations and advertising in college, and during my second year of college, um, I apparently had too much of a free time, so I decided to find a job. And thanks to my sister, I found out that there is a job opening in an NGO called All Ukrainian Network People Living with HIV, and they were looking for a public relations manager. I'm like, sounds interesting. Let's do this. So, to be honest, those 4 years of my life were most impactful and meaningful so far.
Mhm.
We did so many amazing things, some great projects. Here's an example. One of the big problems we had is that people with HIV positive status in prison, they don't
Uh-huh.
have access to the treatment. So we had this challenge to negotiate with the penetration system, Ukrainian penetration system, to allow them get the treatment because people were literally dying without the treatment. And I don't know if you know this, but adherence for HIV therapy is so important. Like if you take pills, like the adherence is less than 90%, 90, then it basically doesn't work. That means that a
Mhm.
person needs to take a pill, I think 2 times a day back then. I think it's only one now, but at very specific time every day, the whole their life. So in prison, nobody would give pills to prisoners just to take that. So the guards were supposed to come to a prisoner twice a
Mhm.
day at a specific time every day. And that when we started talking about this with them, they're like, there is no way this is going to happen. But it
Mhm.
took us, I think, 2.5 of long years of working advocative campaigns, press conferences, trainings for prisoners, and we finally managed to do this and got the treatment to prisoners. That
Mhm.
was really huge.
Uh-huh.
Also, I organized press conferences where first Ukrainian with HIV positive status disclosed her status on national TV. That was also amazing because stigma and discrimination uh, is such a big problem, and it was a big problem in Ukraine. I think it's much better now. So yeah, I think we've done a lot of amazing things, and of course, to do my job well, I had to know the topic really well. So I learned everything about HIV and the treatment. I became a certified international HIV prevention trainer.
Mhm.
Conducted 200 plus trainings, and yeah, those 4 years were amazing. But then I graduated college, and I I had to find a job where I can actually make some money.
Yeah.
NGO doesn't pay you well, so uh, basically I got into the tech company, still doing public relations, and a few years later, I felt like I reached the ceiling, so I decided to do the transition to project management. And again, by accident, first few large projects that I had were healthcare related. So I learned everything about regulations and all that stuff. And then when I was changing companies, I was looking only for digital health projects. So
Mhm.
yeah, and then a few years later, I co-founded a tech company where software development and hardware development company, and I would say 80% of our portfolio is digital health projects.
Mhm. Awesome. And could you describe the healthcare system in Ukraine as of now?
Sure. So I would say it's definitely much more simple than the American healthcare system. And when Soviet Union basically fell apart, we inherited that healthcare system, which essentially is free. Like the government pays for everything. But of course, it sounds really nice, but it doesn't work. Like back then, like 20 years ago, doctors were having a salary of $100, and they could not really provide a really good quality care with
Mhm.
having such a low salary. So there became lots of out-of-pocket payments directly to the pockets of healthcare providers, with of course no taxes, nothing, no control. Like whatever doctor thinks the surgery cost, they're gonna say this amount of money to a patient, and you cannot really do anything with it. So everyone understood that the healthcare system was broken. And luckily, a few years ago, probably like 8 or 9 years ago, a new minister of health came to power, and she started this reform, which is still going. But I think she did some really great things. Uh, healthcare is still supposed to be partially free, like first aid and stuff like that. Some procedures and things you have to pay out of pocket. But I think the most important thing that she did is she actually made every Ukrainian sign a contract with the, I think in the US that's called PCP, primary care physician. In Ukraine, it's a family doctor. So, and each doctor started to get paid according to how many patients he has. So now, me as a patient, I actually have power. If I don't like this doctor, who is like my main point of contact to access all other healthcare services, I'm just gonna go to another one. So now at least doctors are motivated to provide a good care, and that was like huge shift to, I guess, some sort of value based care or performance based care. And I think, yeah, there's definitely a long way to go, but that change was dramatically important to improve our healthcare system. And
And
yeah, I forgot to mention that insurance, comparing to the US, it's not really a thing
mhm.
in Ukraine yet. I don't know the stats, but I think very low percentage of Ukrainians is using insurance. So it's still most of the payments are out of pockets. But again, a lot of international insurance companies started coming to Ukraine late last few years, especially before the full invasion, and starting promoting, advertising healthcare insurance. And I think we're gonna adopt that concept of healthcare insurance very soon.
Mhm. And how does the you previously kind of alluded to it in my previous question, but what did you notice between those two healthcare systems in the U.S. and in Ukraine? What was drastically different? Like, what did you have to learn, kind of in the U.S. system that wasn't necessarily existent in the Ukrainian healthcare system?
Sure. So well, let's. I'll give you a few examples of pros and cons of both systems. So, if we talk about pros, about American healthcare system, I think the whole infrastructure, medical equipment, innovations is definitely way ahead of Ukrainian healthcare system. Like, here's a simple example: when you go to the ER, most of the times we still have those X-rays when you need to print the image,
Hmm.
wait till it actually dries out, and then carry that image yourself to a doctor on a different floor to show what's happened with you. And if you have a broken leg, that's quite a challenge. So that equipment, of course, is expensive, and we need to invest a lot of money to move to more modern equipment. So this thing in the US is definitely way better. But if we're talking about pros in Ukraine, to be honest, I never experienced problem with getting an appointment with a doctor in Ukraine. I think we don't have that lack of healthcare providers in Ukraine that you do have in the US. Uh, it's hard to imagine that I need to wait for a month or even a week to schedule an appointment in Ukraine. Here, it's a common practice. People wait for sometimes for months to get an appointment with a doctor, and that's something that definitely needs to be addressed. For instance, my house uncle here in the U.S. He's got a pretty severe pain in his stomach, and I called him, I asked him when are you going to the doctor, and he said like in 3 weeks. I'm like, some days he can barely get off his bed, and he still need to wait 3 weeks just to get an appointment with a doctor. That's nonsense, I believe.
Mm-hmm. No, that's very eye opening, and it kind of kind of makes you realize kind of, oh, kind of what are the similarities and differences between how different countries, uh, how I guess the way to say it is how they define public health specifically for their respective populations.
Right.
And I just want to change gears for a second. So your newsletter, U.S. Healthcare, examines the United States' healthcare system through the eyes of a Ukrainian refugee with a focus on innovation. And what really stuck out to me is that phrase, or excuse me, that word innovation. What does that particularly mean to you?
Sure. So I've been developing software for healthcare industry for the US market for 10 plus years.
Uh-huh.
So from the technical perspective, I know all the regulations, how to build a secure software, how to protect PHI, all that stuff. And I was like, yeah, I know how to build a solution for the US healthcare system. But when I actually got here just this May, I realized that I really don't know how the healthcare system here works, how the system works. So even if I know the technical perspective, the business perspective is something that I still need to understand in order to be able to build that solution that is going to be effective and cost effective, I guess. And that's the problem for lots of startup founders around the world who are not in the US. Let's be honest, everyone is dreaming to get to the US market. It's really big, a lot of money. So every digital health startup founder is dreaming to get to the US market at some point. And it's very hard to do that just to build a technical solution without understanding who's going to pay for it, who is the recipient of the solution, and stuff like that. So I think my newsletter should help a little bit to understand people not who are not in the US how to approach and how to create a startup that actually innovative, but also considers all the organizational and business wise issues here in the US.
Hmm. And where do you see the role of AI playing in the United States' healthcare system, and how would you like, you being the COO of BeKey, how would you like the BeKey organization to contribute to that conversation?
Yeah, AI is definitely going to impact all the industries and healthcare specifically. And, you know, there are so many use cases already. Everyone is talking how AI can improve healthcare. I think the most common ones are that help the doctors how to simplify doctor's life, like for instance transcribe the consultation with a patient to text, so a doctor doesn't need to spend lots of time just typing that thing after the consultation is over. And I get this, I really support this, especially considering the lack of specialists. But from my perspective, I really think that some simple things that with patient first in mind is something that we need to focus as soon as possible. And here's a simple example.
Hmm.
For over the past 6 months, I've spent literally hours of my life on the phone trying to schedule appointments, make sure that this hospital is a partner with my insurance, so it's going to be covered, and all that stuff. And a fairly simple AI agent that has access to my Google Calendar with a prompt, "Hey, schedule an appointment for me with this type of doctor within this area, and it should be covered and should be partnered with my insurance company." Sounds not like a rocket science. I think like a simple solution, but it saves so much time for patients around the country. So I think those simple solutions that we actually already have all the tools to build them right now, those should come first, and then we can move to something more complicated like chatbots that can help with the simple diagnosis for patients and stuff like that. That's going to take a while because you need to validate the data that it's using to learn. You need to improve and fix some issues, and of course regulations should be also in place in order those solutions to be used.
And from what you've seen, is it just kind of an apathy towards the technology? Is it a shortage of people that have those respective skills to build those applications and to implement them, or is it just a lack of people within the healthcare space, or is it kind of a combination of those three?
Yeah, it's definitely a combination. And well, first of all, like AI with ChatGPT and other LLMs that appeared late last couple of years, it's still startup founders definitely rushed into that space. So I believe we just need a little bit of time. And talking about BeKey in our company, we also planning to invest resources in building AI agents and working in that space. So first of all, we need just a little bit more time to get used to working with AI, create some solutions, test them, and actually deliver to mass market. And also, there's definitely some barriers from hospital perspective. Adopting new solutions isn't something they're super excited about, at least from my perspective, from what I can see. So there's definitely combinations of reason, and we need to work all together in order to make that happen.
Mm-hmm. And the last question that I have is, from your perspective as a Ukrainian refugee, what is one particular area that you elected officials must become more knowledgeable about, specifically in applying AI into the healthcare sector?
Ooh, that's a tough one. Um, well, first of all, to my few previous points, I think they need, like when creating regulations and stuff, I think they need to think patient first,
Mm-hmm.
because yeah, we have a lot of effort to improve and simplify a doctor's life, and make healthcare more cost efficient. But a lot of times we just forget about patient needs. And I think they definitely need to think patient first when working on the regulation they come up with. And the second thing, that the development of AI is moving so fast, like even comparing to what we had like a year ago, and now it's a completely different story. So we definitely want some regulations to be in place, so we don't see cases like, for example, with Healthcare United Group happen, when their AI algorithm just declined healthcare for elderly and other patients. But we don't want regulations to stop the speed of AI development. So I know this is super hard, but I want to ask them like to try to adopt regulations as fast as possible, but keep in mind that there's definitely some things that they have to protect in order to be successful.
Awesome. No, that's very helpful to kind of hear from your perspective on that. And Alex, just out of curiosity, where can people find more about you if they're interested in connecting with you?
Sure, it's either LinkedIn. I'm pretty active there, and of course, sign up for my newsletter.
Mm.
Also, we have a digital health YouTube channel. You can sign up for BeKey Digital Health YouTube, and our company website beekey.io is also a good source to get in contact with me.
Oh, awesome. Thank you again. And do not forget to hit the like button and subscribe to my channel. Podcast episodes are also available on Spotify and Apple Podcasts. And do not forget to check out my newsletter, the AI Healthcare Report, on LinkedIn. This is Dylan Reed signing off. Thank you so much for your time, Alex.
Thank you.